I'm joined today by Regional Councillor and the lead of our reopening working group, Councillor Marta Medeiros. We're also joined by Dr. Lowe, our Medical Officer at Health in Peel Region, and Paul Morrison, our Director of Bylaw Enforcement. I want to start today by just taking a moment to acknowledge the tragic discovery of 215 children found on the former site of the Kamloops Indian Residential School. Horrifying. It makes your stomach churn. On behalf of the City of Brampton, I extend my deepest condolences to the survivors of the residential schools, their families, and their communities who relive and experience their traumas when devastating news like this is brought to the forefront. We stand in solidarity with Indigenous communities and recognize the significance of reinforcing the commitment to the truth, justice, and reconciliation process. I also want to acknowledge that it is Pride Month in the City of Brampton. Love is love is love, and we've got a great array of virtual celebrations for the LGBTQ plus community, and I would encourage you to visit the brampton.ca website to learn of some of those virtual opportunities. I want to start today by talking about our vaccination campaign. And the vaccination efforts in Peel Region have been robust, and I want to applaud Dr. Lowe and Dr. Mohammed, who have been spearheading the charge locally in Brampton. 72% of adults over the age of 18 have been vaccinated, and I believe over 40% of those over 12. So this is wonderful news, and we're going in the right direction. But I would note that there is some caution in that sea of optimism over the high vaccination rates. I remain concerned about the international variant B1617, which was first found in India, now known as the Delta variant. And I just want to underline, if the government's position continues to be that there will not be restrictions on international travel, for me, which I have to say, I agree with the provincial position that the federal government should have more restrictions. But if that's not going to change, it really speaks to the fact that we do need to have an aggressive second dose strategy in our hotspots. I'm concerned that first vaccine coverage will not be adequate when it comes to some of these variants, and we've got crowded factories and warehouses, and that's how it spread out across the province initially. So we need to get second doses to our essential workers to make sure that this variant doesn't take hold like we've seen it take hold in other jurisdictions internationally. On that note, if we get the supply where we're able to give second doses, and that's a big if, because right now we're getting about 9% of the provincial allocation and we're 11% of the population. But if we get that supply, we have a vaccination campaign that is going to start today. It is called Get Back to Better, Vaccinate Brampton, and we have notable community residents who have all recorded messages about why they're getting vaccinated to protect their friends, family, and their community. So stay tuned for watching some of those commercials and those messages. They'll be shared throughout the city of Brampton on why getting your vaccination is so important, and the personal reasons why many of our residents got their vaccine, whether it's looking out for a grandmother, a loved one, their neighbor. There's some pretty powerful stories about why it's so important to get vaccinated. I should also note we continue to have strategic vaccination centers focusing on areas that aren't vaccinated. Right now, there's a real effort for those over the age of 12 to get vaccinated. There is a variety of options to get your vaccine, including walk-up options, and there's actually a pop-up taking place right now at Sheridan College's Davis campus in Brampton. It's open today, it's open all weekend, and we're hoping as many students get their vaccine as possible. You can book your vaccine by calling 905-791-5202 from 8 a.m. to 8 p.m. And of course, you can book your vaccine online as well. I should also note, in terms of outdoor amenities, that is full steam ahead. On May 22nd, the following outdoor recreational amenities were permitted for use: golf courses, driving ranges, soccer and other sports fields, baseball diamonds, batting cages, tennis and basketball courts, lawn bowling, bocce, splash pads, BMX, and skate parks, and we're hoping that list will be expanded even further very soon. But for residents interested, if you go to brampton.ca, we have a complete list of open recreational amenities for residents to use. And the great thing is, in every neighborhood in Brampton, there are safe outdoor recreational amenities you can use. Outdoor amenities are great for your physical health, it's great for your mental health, and so I hope Brampton residents enjoy these outdoor amenities and will make use of that map of where the different recreational opportunities are available. I should also note that the City of Brampton's recreation team is working towards the introduction of summer camps, fitness in the park, and other outdoor programming as restrictions continue to change. I know the Premier has said he wants to see summer camps back on this summer, and we will be ready as soon as we get the go-ahead. The plans are already underway. I've heard from many residents about how important it is to them that our team is working to set these up as soon as the green light is given, and I want to assure our residents there'll be no lag time. We are ready to go. For more details on our local recreation, you can go to brampton.ca/recreation. In terms of an Osler update, the picture continues to get better at Osler Health. And as you know, we were the front lines of the pandemic. We had the busiest hospital in the province. And right now, we are starting to see some real relief on the pressures at our hospital. This week, there are currently 37 COVID patients at Brampton Civic Hospital, including 9 in ICU. So that's remarkably down. There are only 24 COVID suspect patients who are awaiting test results. That's the smallest number that I've reported in months. And so this is encouraging progress. But once again, I add the caveat that there is concern about that variant, the Delta variant. On a bylaw update, bylaw laid 15 charges under the Reopening of Ontario Act from May 25th to May 30th, but once again there was broad compliance from the public with the existing public health rules and the provincial emergency protocols. So on that note, it's my pleasure to introduce Councillor Marta Medeiros, who is spearheading our reopening working group so that we are ready to reopen as soon as it's safe and appropriate to do so.
Thank you, Mayor Brown. Good morning, everyone. My name is Marta Medeiros, and I'm the Regional Councillor for Wards 3 and 4, and also lead for the Mayor's Reopening and Recovering Working Group. We are encouraged by the province's 3-step plan for a gradual reopening. This is a reflection of our collective efforts to overcome the pandemic by placing health and public safety as our first priority. As we wait for more updates from the province, here are 3 important things to remember. First, the provincial emergency declaration stay home orders ends today, June 2nd. And I know there's been some confusion. There's been a lot of expectation that as of today that some things would open. Essentially, the emergency break rules are still in effect, and we we're still moving towards step 1 reopening. This means it's important we keep our outings to a minimum and for essential purposes only. For example, groceries, pharmacy, healthcare services, for exercise, or for the essential work. Second, outdoor recreational amenities such as golf, sports fields, baseball diamonds are permitted, but only to get basic exercise. Outdoor fitness classes and team sports, including practice, is not permitted in sports fields or courts. Outdoor splash pads are open. Lastly, outdoor social gatherings and organized public events are allowed up to 5 people, including members of different households. So let's continue to work together and keep our focus on getting vaccinated and following safety measures in the lead up to the gradual reopening. And just lastly, I would like to just recognize that we know businesses, restaurants, patios, we've heard loud and clear, and as the Mayor suggested, as soon as we get the green light from the province, we'll make sure that not only our facilities will be there, but we'll be there to assist all the local businesses where they need help. So I just want to thank everyone and thank Brampton staff for everyone coming together and putting in their hard work so that we can move into a safe reopening. Thank you.
Thank you, Councillor Medeiros. And on that note, it's my pleasure to introduce Dr. Lawrence Lowe, who is spearheading the public health efforts in Peel Region.
Thank you, Mr. Mayor, and good morning. Good morning, Councillor Medeiros. This week, Brampton's test positivity is at 10.4% with a weekly incidence rate of 131 cases per 100,000. Hospitalizations also continue to resolve, meaning that more of our residents are recovering and fewer are getting sick. And vaccine coverage with first doses is improving. However, even while the stay-at-home order expires, we must continue to remain vigilant. Despite decreasing trends, our rates remain the highest in the province. And while the current trend may seem favorable, we cannot forget what a formidable foe COVID-19 has been. 3 waves and 100,000 cases in our community, many lives lost, though many more saved thanks to the sacrifices and measures that have held transmission at bay. However, we cannot grow complacent and we must remain vigilant. I've said this before, and I too know that we all want this to be over. But COVID isn't going away, and if we immediately start to act like it's over before it actually is, we will be quickly reminded that it's not. In particular, members of the science table this week have advised Peel Public Health that B1617, now known as the Delta variant, first detected in India, is increasingly being detected in Ontario, and that Peel region has the highest proportion of this variant out of the entire province. We've only just started getting back preliminary lab results and analyses from our provincial laboratory partner, and the trends being observed are concerning. B1617 is quickly replacing B117, which was the Alpha variant originally detected in the UK, and which drove our third wave across Brampton and the region of Peel. We currently have 97 cases of the Delta variant in Peel, including some that have been acquired in the community. And preliminary analysis from the science table suggests that in 1 month, the Delta variant will be the dominant strain in our region, with the rest of Ontario weeks behind. With initial signals suggesting that the Delta variant is also more transmissible and severe on top of the Alpha variant, this means we very much welcome the province's continued cautious reopening as one component to preventing a 4th wave. Caution is essential. The other component is to continue vaccinating. We have thankfully now delivered over 1.1 million doses of vaccine here in the region of Peel, reaching 72% coverage of our adult 18+ population with first doses. We've now also achieved 40% first dose coverage in our 12 to 17-year-old population. However, science is clear that with the new variant, the new Delta variant growing, we need to move quickly to 2 doses for maximum protection. We saw this in Bolton in the United Kingdom, where they rushed in second doses into that community to get ahead of the virus. I understand that these analyses from our science table partners are preliminary, but there is discussion underway to see what it would mean in terms of accelerating second doses in regions such as Peel, where the Delta variant is becoming increasingly predominant. Slowing the variant in such areas as Peel is critical to ensuring that all of Ontario is protected and that we can continue to move forward in confidence with reopening. And I am certain that our science table colleagues will share their data in greater detail in the coming days. But for just a while longer, I encourage our residents to continue to limit their contacts with those that you don't live with. Stick to the precautions. If you've not had a first dose yet, get your first dose now because waiting leaves you vulnerable. And if you've already had 1 dose, get your second dose as soon as you are eligible. We're hopeful that with supply, we might be able to accelerate second doses to get ahead of the Delta variant in our community. So please visit peelregion.ca/COVID-19 vaccine to book today. It's in our hands and our arms at this point to keep our reopening on track. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. On that note, I'm happy to take some questions. First up is Courtney Heels from CP24.
Good morning. This question is for Dr. Lowe. The province is expected to announce whether kids will be returning to the classroom this month, and we're hearing that schools might stay closed so that the economy can reopen. My question to you, sir, do you think there is a way to both reopen schools, get kids back in the classroom, and the economy, and also keep the case numbers down?
So Courtney, certainly there are challenges around all three of those things that you've just described. We do know that with the remainder of the school year and the opportunity for mental health and well-being, that reopening schools would provide that for our children. However, as I shared in my remarks, we are starting to monitor what this Delta variant means for our community with the preliminary analyses from the science table. And I think our focus at this point in time is really trying to make sure that we continue to limit contact interactions through whatever measures are possible, just for a while longer while we try to get accelerated second doses in communities such as ours that are seeing the Delta variant more and more predominantly. Thank you very much.
Thank you. My next question is for Mayor Brown. Mayor, you mentioned that second doses need to go to essential workers. Are you then now calling on the province to attempt to bump up that group to see essential workers get access to the second dose sooner?
If you saw how previous waves really moved in Ontario, it was because of spread in Ontario's hotspots. The hotspots, the spread became so significant that it spread out across the province. And my worry is that this could be a repeat of that with the Delta variant. And so the smartest approach would be to make sure that it doesn't get out of control. We still have an opportunity right now to win the battle with the Delta variant. The last variant, we lost the battle with the UK variant, but I think we have a unique opportunity now with additional second dose allocations for the hotspots in Toronto and Peel. We could get ahead of this. But right now, our essential workers who are on the front lines of the pandemic, where we've seen the spread happen most significantly before, don't have that second dose coverage, which is critical to the effectiveness of combating the Delta variant. So yes, I believe there needs to be additional allocations made of second doses for our essential workers in the hotspots. Our next question is Graham Frisk from the Brampton Guardian.
Good morning, guys. How's it going? My first question would be for Dr. Lowe. I'm just curious, there was some talk in the past couple of weeks about some concerns about the vaccine's efficacy for the Delta variant and other variants. I'm just wondering if you have any update on that and if the science has changed or if there's any update on that.
Yeah, thanks, Graham. So as we know, the UK has seen some increase in the Delta variant, weeks ahead of us as they have started to reopen. I mentioned that the experience of Bolton in the UK is particularly instructive, and there is preliminary analysis from Public Health England that one-dose coverage is about 33 to 50% effective, and two-dose coverage, thankfully, is still approximately 90% effective. So that really speaks especially to just this preliminary signal that the science table has advised us, a need to start having a conversation around where we go with second doses, particularly in areas of Ontario such as ours that might be seeing a surge of the Delta variant. Thanks for the question.
My follow-up would also be for Dr. Lowe. I guess there's a new variant. I mean, what information is available right now for this variant that was discovered in Vietnam? And is there any discussion, and would you support a travel ban for that country similar to the one implemented for India and Pakistan with the previous variant?
Thanks so much, Graham. I think in general I've spoken not just in respect of individual travel bans for countries that are federal partners, but really the idea of looking at quarantine overall as we really try to get things under control here in Canada. There will be a recognition that many other parts of the world are still facing significant challenges with COVID-19 transmission, and so there will be a need to look at how we overall look at quarantine measures to really, as opposed to sort of one-off or individual country restrictions. Certainly the Vietnam variant is one that is being actively studied. It's not yet identified as a variant of concern, and we do know that Vietnam has actually strictly limited travel in and out of that country. So at this point in time, the possibility of it leaving Vietnam is maybe a little bit less than other countries that have not instituted similar measures. So we'll continue to monitor. Thanks so much.
The next question is Irene from 680 News.
Good morning. My question is for Dr. Lowe. As people book their second dose, will there be vaccine mixing? If someone got Moderna or Pfizer, how do they know what clinic will have their first vaccine? And if you got Moderna, will you be allowed to get a Pfizer shot instead?
So thanks so much for the question, Irene. First of all, the National Advisory Committee of Immunizations guidelines are still favoring the goal of trying to vaccinate with the same product with a second dose if you can, and then if not available, any of the mRNA vaccines. And so we are continuing to try to make sure all those products are available at our clinics. I believe the provincial booking system does indicate which vaccines are available at which clinics because we know that only one of the products is approved for under 18s at this point in time. And so I think that there's that there. And the last thing I would share is that, there are a lot of questions around Moderna, and I know you'd asked that in your question. I want to be very clear. Moderna is a safe and highly effective mRNA vaccine. It uses the same technology as Pfizer. Many people, including myself, have received the Moderna vaccine, and I would encourage people, if you are getting your first dose and you show up and it happens to be Moderna, I encourage you to take Moderna with confidence. Certainly I did, and I would certainly have been fine with any of the products, but I think Moderna is just as good as vaccine as Pfizer is, frankly. Thank you.
My follow-up is also for Dr. Lowe about the Delta variant. Do we have any numbers as to how many cases we've seen in Peel? On the provincial board, we see all the other variants broken down, the three major ones. Will we soon be seeing that so we know how many numbers we have?
Yes, thanks, Irene. And actually, I realized I may have omitted it from my remarks, but we have now had 97 cases of the Delta variant reported in the region of Peel, and those numbers will be updated on our weekly epidemiologic report. My understanding is, of course, our provincial laboratory partners have been, working tirelessly to pivot from the former variants of concern, or still variants of concern, but the ones that drove the third wave, to try to detect the Delta variant more and more. And so I can confirm at this point in time we have 97 cases that have been detected in our region to date. Thanks so much.
Okay, our next question is Sabrina from Mississauga News.
Hi there. So my first question is for Dr. Lowe. Dr. Lowe, would you endorse a second hotspot strategy for Peel region given the circumstances surrounding the Delta variant? And if so, what % of allotment would be needed to sort of combat that?
Yeah, thanks so much, Sabrina. I mean, I don't necessarily know what percentage of allotment or how that would look like. I mean, this is an area of active discussion with our science table colleagues at this point in time. But as I understand it from our science table colleagues, they are seeing certain areas of the province increasingly have outbreaks with the Delta variant, not only Peel, but I also believe in the north in Porcupine. So I would imagine, I'm in the process of just waiting for the science table to really put forward what they would see as the best way to accelerate any second dose strategy to get ahead of the Delta variant. Thanks for the question.
Thank you. So my second question is for Mayor Brown. So given the circumstances surrounding the Delta variant's increasing spread, in terms of reopening businesses such as patios or outdoor dining or beauty services, when would you like to see this happen?
I think the science table has been clear that outdoor amenities are relatively safe, and so I think we can safely have outdoor amenities, whether it's recreation that has already been opened partially. I certainly think we can open patios, but what I would add is we really need to protect the crowded indoor environments. And the reason I'm asking for a second dose focus in the hotspots is I'm concerned that where we saw the spread happen previously, it was in these crowded factories. That's where we need to really make sure we have protection, inspections, and adequate vaccination levels. Our next question is Nitin Chopra from Prime Asia TV.
Thank you. My first question is to Dr. Lowe. Dr. Lowe, many studies coming out and it says that there are more side effects after the second dose. Any concern, or what kind of side effects are those?
Thanks, Nitin. So certainly there are side effects with either dose of the vaccine. Most typical side effects are mild, so pain at the injection site, redness, sometimes fever, chills, mild fever and chills, fatigue, lethargy. These are all common side effects. It's basically your immune system fighting off the primer that's actually meant to allow you to actually fight off the real infection if you ever were exposed to COVID-19, and those should be anticipated to be normal. They're seen with both the first and the second dose, and I would just say to everyone, the vaccines are safe and effective, and frankly speaking, those side effects related to the vaccines are a lot better than getting COVID-19. Thanks so much for the question.
Thank you. My second question is to Mayor Brown. Mayor Brown, since you were also into the police board earlier, so crime also goes into the pandemic. There was a search operation in Brampton House and Mississauga House. After that, Deputy Chief Nick Milinovich, he tweeted, very disappointing to learn that one of the accused from these serious, Rohit Rihal, was on bail for attempted murder. Question is that if Deputy Chief can post this kind of tweet, don't you think that police morale hurts sometimes by catching repeated offenders again and again? And if no politician ever talk about changes in the reform system, you wrote a year ago to the ministry. Any response, or what are your thoughts onto this? Because we need to make our police forces more strong, as this tweet is very shocking when Deputy Chief put this kind of tweet. Thank you.
Thank you, Nitin. And as you know, I retweeted the deputy's tweet because I feel strongly that what he's speaking about is a desperately needed reform to the justice system. Bail reform is desperately needed, and we've had too many incidences, and we had one last summer where there was an individual who was released on the fifth occasion, ended up resulting in a fatality. And we haven't had a response from our bail reform petition or our letter from the federal government, but I would say that the GTA mayors and the chiefs of police throughout the GTA are working together to lobby for that reform. We've had a meeting as recently as last week with Bill Blair and Sylvia Jones, and I would say the provincial and federal government are actively engaged in a conversation with GTA municipalities on how we can make improvements to bail so that we don't have a situation where you have police doing the hard work of getting the bad guy or individual behind bars and then seeing them released, because that is demoralizing for the police that engage in that difficult work. Our next question is Nikki Cedrone from the Bramptonist.
Hi, good morning. Both of my questions will be for Dr. Lowe. Dr. Lowe, why do we have to wait until June 16th to move to step one of the reopening when we've reached more than 60% of adult first dose vaccination?
Thanks, Nikki. That's a great question. Certainly, prior to the preliminary analyses that were shared with me by the science table, I might have asked the same question as well. However, given the remarks that I've shared today with an increasing signal that the Delta variant is circulating in our community and that one dose coverage is only potentially 33 to 50% effective based on data in the UK, we know that one dose coverage may not necessarily be enough for areas that are seeing the Delta variant. And so I'm hopeful, of course, that the science table analyses will be finalized and shared more broadly in the coming days, but it does speak to the need to continue. To be clear, I'm not recommending any changes to the reopening schedule at this time. I'm fully supportive of things going forward on June 14th as we've identified, but gradually, slow and steady as it goes is how we do it, along with the need to accelerate potentially second doses in our region. Thanks for the question.
Thank you. Dr. Lowe, are we able to distinguish between those who have been vaccinated and those who have not been vaccinated when it comes to current positive COVID cases?
Absolutely. Thanks, Nikki. As you know, we do meticulous case and contact tracing with every case that is reported to us, and vaccination status is one of the questions that is inquired about. That information has been put together in a province-wide analysis. I believe Public Health Ontario released that a couple weeks ago, just initial data on first doses. And I think on millions of doses delivered to Ontario, there are only like 2,000 or so breakthrough events, or thousands of breakthrough events. So the vaccines work. They are effective, and those breakthrough events, I believe they tended to be mild, and a lot of them tended to be within the 14-day period that the person's immune system is ramping up. So we do ask that question, and we continue to monitor vaccine status in our contact tracing. Thanks so much.
Okay, that completes our COVID-19 update for this week. I want to thank everyone for calling in. And until next week, please stay safe, healthy, and listen to the advice of public health.